Hello, I'm Dr. Diane Bowen. I'm the founder and medical director of Golden Isles Center for Plastic Surgery and Centered on Wellness, where we help you achieve your beauty both inside and out. Welcome to this month's video blog of Health Matters, where we explore those issues in the news that are important to your health. Today we're going to be talking about breast implants. In my 20 years of experience, I have seen breast implant technology change tremendously, much like the technology of Model T Fords to the modern Ford Explorer. When I first went into practice, breast implants had very thin shells, and the consistency of the gel inside of them was much like that of honey, and it would literally leak through the shell, leaving a tacky residue on any table or surface that the sample implant was placed on. Now this ended up causing problems within ladies and leading to some scar issues. And as a result, those implants were taken off the market in the early 90s. Over time, breast implant technology improved, especially as implant companies tried to respond to the need and those ladies who needed breast reconstruction for a better, more natural feeling implant. Now, implants come in two varieties. This is a non-textured or a smooth shelled round implant. This is a textured device, and as you can see, it's also shaped. This device was initially designed to mimic the shape of a breast and to help ladies with breast reconstruction achieve a more natural look. There has been the discovery of a type of disease called breast implant associated anaplastic large cell lymphoma. You may see these initials as BIA-ALCL. Now the chances of getting this, if you have a textured device, is very small. So small that you have a 33 greater chance of getting struck by lightning. Now, some of us have met someone who's been struck by lightning, but I doubt we know 33 people who have been struck by lightning. And that is the same risk of getting ALCL from your breast implants. Now, that is not to minimize the concern, and certainly if you notice any increase in redness or swelling or tenderness in your lymph nodes, you obviously should get this looked into. And if ALCL is caught early, the treatment is relatively straightforward. It's the removal of the device and removal of that scar tissue around the device. Why would implants cause this? It is thought that this texturing on the shell is actually acting like a rough emery board-like surface, and that it is irritating the tissues and then eventually, in some people, and only a few, leading to this ALCL. So what should you do about this? Should you go out and get your implants removed? No. If you know that you have a textured device, and you certainly should be able to know that from a device identification card that was given to you at the time of your surgery, and you have one of these textured devices, while the implant companies will not cover the cost to remove the device, they will replace the device at no cost. If you have a smooth device, there's no cause for concern because ALCL has not been found in ladies with smooth devices. And as a matter of fact, the only texture device that is at risk as of right now is those made by a company called Allergan. Now, there's another thing that has recently been on the internet a lot called breast implant associated illness. And the symptoms for this are relatively vague. It can be things like fatigue or poor digestion or arthritis. Now, before you go off and have a surgery to have your implants removed, I would urge you to get a thorough nutritional consultation and evaluation to look at things like low vitamin D and low B12, because these are certainly much more common reasons for fatigue and other health issues. As a matter of fact, vitamin D, low vitamin D, is associated with all types of cancers, including breast cancer, prostate cancer, multiple sclerosis. If you can get your vitamin D above 50, then you would reduce your risk of breast cancer by half, and that is great news for all of us. Now, I want to thank you very much for your attention today. If you have any questions, please reach out to us. Our web is www.drdianebowen.com or www.centeredonwellness.net. We are always happy to hear about topics that would be of interest to you. Please like us on Facebook. Thank you.